Hello viewers, in this particular episode we're going to discuss about type 1 diabetes. Many people ask us as to which type of diabetes they have. Mainly there are three types of diabetes. Of these, type 2 diabetes is the most common variety, type 1 diabetes is less common, and there is a third variety called MODY. There are other sub-varieties and less frequent varieties, but we're not going to discuss about all these varieties in this particular episode. We're going to focus about type 1 diabetes in particular. What is type 1 diabetes? Type 1 diabetes is a condition in which blood sugar levels go up or get elevated, usually in kids and teenagers, although it can occur even in adults as well. This is due to lack of insulin or deficiency of insulin in the body. What happens in type 1 diabetes is that the pancreas, which is the insulin producing organ, is unable to produce enough insulin. So as a result of this, what happens is the blood sugar levels go up. It occurs usually in kids, can also occur in young adults as well, and sometimes even in older adults, although it is usually seen in kids and teenagers more frequently. This is very important because in certain circumstances what happens is even type 1 diabetes is wrongly labeled as type 2 diabetes when it occurs in older adults and mid-aged adults, and it is wrongly treated, leading to dangerous consequences. Hence the reason why type 1 diabetes should be identified promptly and treated appropriately. Why do people develop type 1 diabetes? People develop type 1 diabetes usually due to autoimmune problems. What are autoimmune problems? Autoimmune problems are diseases which occur when immunity in the body or immune system in the body goes hayway. For instance, if the immune system in the body, which is supposed to protect us against bugs, is directed against our own body and does damage to the bodily organs, we call it as autoimmunity. In type 1 diabetes, what happens is the beta cells, which are the cells in the pancreas that secrete insulin, are destroyed by our own bodily immune system, which results in deficiency or complete lack of insulin in the body. This results in elevated blood sugar levels. How do we actually know that an individual has type 1 diabetes, or for that matter diabetes? People can develop various symptoms and signs such as excessive thirst, passing too much urine, nocturia, that means waking up too many times in the night to pass urine. Some can even have blurred vision, extreme tiredness and lethargy. Some can have problems such as thrush, that means fungal infections. Some people develop sickness or illnesses non-specifically very frequently when diabetes is not picked up appropriately and treated accordingly. Moreover, some people can also have weight loss, and there are instances when some individuals might end up in a dangerous type of coma called diabetic ketoacidosis if diabetes, when I say diabetes, here I mean type 1 diabetes, is not diagnosed promptly and treated appropriately. I will discuss about diabetic ketoacidosis in a bit, but before going to that, we need to know about how we diagnose type 1 diabetes. We diagnose type 1 diabetes based on history and blood tests. If an young individual, say a child or a teenager, or for that matter an young adult, tends to have any of the symptoms that I discussed earlier, then alarm bells should ring and that individual should be immediately taken to the doctor, who can do simple tests such as checking blood sugar levels, and also another blood test called HbA1c, which gives an average of the last 2 to 3 months blood sugar levels and thereby diagnose if this individual has diabetes or, in this particular instance, type 1 diabetes. Once the doctor picks up that the blood sugar levels are elevated, he or she would immediately start this individual on insulin, because in this particular type of diabetes, the only treatment is insulin and nothing but insulin. Insulin is an injection. Although we do have some inhaled varieties of insulin, in this particular scenario, we ought to start injectable insulins only, and it is a fairly simple, straightforward treatment provided appropriate training is given to the patient and to the care providers. Because usually it is kids and teenagers who are affected, it is very important to educate them about the importance of taking insulin, not to miss doses, and also to be vigilant about low blood sugar levels, because if timely food is not taken, too much exercise or sports activity is undertaken, then that can lead to low blood sugar levels, which is called as hypoglycemia in medical terms. Hence the need to educate both the patient as well as parents and other care providers to know how to administer insulin, what doses to use, how to know whether the individual is having hypoglycemia, that means low blood sugar levels, how to prevent low blood sugar levels and treat low blood sugar levels when they happen. It is also very important to ensure that a dangerous type of coma called diabetic ketoacidosis is prevented by ensuring that insulin administration is not stopped in any circumstance. For instance, if the patient were to ever develop diarrhea, vomiting, a viral illness or anything similar which can occur to any individual, this particular patient should not stop the insulin on his or her own, but instead check the blood sugar levels more frequently to ensure that the individual is not having too high blood sugar levels or too low blood sugar levels. Also ensure that he or she seeks medical attention if he or she thinks that things are going out of control, and ensure that insulin is given in the form of a drip if required by appropriate health authorities, in order to ensure that there is continuous provision of insulin to the body and to ensure that ketosis does not occur, that means acid content in the blood does not increase in such a scenario. This is of paramount importance, otherwise that can lead to dangerous type of coma called diabetic ketoacidosis. So this is what we call as sick day rules. It is very important that all type 1 diabetics are trained about this and taught about this. Next, as I previously mentioned, type 1 diabetes is less common. Only about 3 to 5% of all diabetes cases happen to be type 1 diabetes cases, but it is very important that they are recognized on time so that insulin is started appropriately and the dangerous complication of diabetic ketoacidosis is prevented. And if you look at the long-term risks that one can incur due to diabetes, the same apply in type 1 diabetes as well. If diabetes is not well controlled, then people can develop various complications related to the eye, such as retinopathy, cataracts and retinopathy, and also other complications related to the kidneys, such as nephropathy, that means damage to the kidneys, that of the feet, such as foot ulcers, neuropathy, that means painful burning or numbness of the feet, and also pertaining to other organs such as your heart, that means people can develop early heart attacks, and also that of your brain, that means early brain strokes. These apart, individuals can also develop erectile dysfunction. People can also develop frequent infections, be susceptible to flus and pneumococcal infections, which means that they need to take advice from their doctor regarding flu vaccine and also pneumococcal vaccine in order to prevent these dangerous complications. So, if insulin is administered appropriately, in a timely manner, in a manner in which it does not cause low blood sugar levels, but at the same time controls the blood sugar levels in a very nice manner, then all these complications could be prevented and the individual can have a good quality of life as well. So, in order to achieve this, appropriate insulin regimes ought to be started, and these insulin regimes have to be monitored periodically by checking blood glucose levels using a glucometer. Sometimes these insulin regimes can be administered by means of devices called insulin pumps, and also by means of periodic checking by using tests like HbA1c, which is the last 3 months sugar average of the individual at the doctor's clinic. So, ladies and gentlemen, do remember that not all diabetes varieties are treatable by tablets alone. Some varieties of diabetes do need insulin administration right from diagnosis till the end of life, and there is no other option except insulin in the current scenario. So, please do not neglect. If you think you may have diabetes or your family members or friends may have diabetes, do get it checked at the doctor's place and make sure that the advice given by the doctor is followed up appropriately. Take care. Thank you.
ఈ వీడియో మీకు నచ్చినట్లయితే ఓ లైక్ కొట్టండి, మీ ఫ్రెండ్స్ కు షేర్ చేయండి. మీరేమైనా సజెషన్స్ ఇవ్వాలంటే కింద కామెంట్ చేయండి. మరో ముఖ్యమైన విషయం, ఇలాంటి మరిన్ని ఆసక్తికర వీడియోల కోసం కింద ఉన్న సబ్స్క్రైబ్ బటన్ ను క్లిక్ చేసి పక్కనే ఉన్న బెల్ బటన్ ని ప్రెస్ చేయడం మాత్రం మరవద్దు.